My name is Tani Yun, and our group had chosen Japan to describe its country law and certification of the nursing home institution. For the introduction, I will explain about the Japan law in nursing home institution, and my other member will explain about the Japan certification in the nursing home institution. The structure of Japanese law and regulation on nursing home is complicated, which they got two authorities involved and each having established different regulations. The first authority involved is Ministry of Health, Labour and Welfare (MHLW), which supervise nursing home based on the Act on Social Welfare for Elderly. Under this Act, the concept is having is a fee-based home for the elderly or nursing home, with the definition that a center that offers services for keeping elderly person and providing them with nursing care services. Ministry of Land, Infrastructure, Transport and Tourism (MLIT) is involved as the second authority. The MILT supervises nursing home under the Act on Securement of a Stable Supply of Elderly Person Housing. This Act also refers to facilities that provide elderly residents with health and welfare service or service resident, which is rental housing for the elderly, which is provide them with safety check services and life advisory services. Thus, most service residents also fall under the meaning of a nursing home. A kind of law is also implemented in Japan, which is Long-Term Care Insurance Act. This purpose of this act are to improve health and medical care and to enhance the welfare of citizens with regard to people who are under condition of need for long-term care due to disease. For example, because of physical or emotional changes caused by aging and will require care such as bathing, body elimination, waste, and require the functional training, nursing management of medical treatment, and other medical care.
Good day, doctor. My name is Teo Yong-jun. Now I want to present the second part of the introduction, that is the certification of the nursing home at the Japan. These are the two main certification requirements for nursing home, which is medical certification and accreditation. Usually, state agency perform inspection for certification and report finding to the Centers for Medicare and Medicaid Service for final approval. The specific requirements differ by state, but inspection generally focus on safe and efficient patient care, as well as things like safety plans and facility maintenance. In the long-term care insurance, municipal government, which are the insurer, certificate the need for long-term care based on judgment made by the certification committee of needed long-term care established in each municipality. This was the first time for Japan to use the system of the insurer certifying the need for the disbursement of benefits, as well as certifying the extent to which benefits were to be disbursed. Because the medical insurer did not have this type of system, each certification committee of needed long-term care is made up of experts on health, medical care and welfare, and it conducts the secondary assessment but based on the result of the primary assessment. The written remarks of the certification investigator as well as the written opinions of the doctor in charge of the person being assessed. The result of the primary assessment can be overturned because of the secondary assessment when it is deemed necessary, which often happens. The reason the process for the certification of long-term care needs have two stages, that is the primary assessment and the secondary assessment, is that the applicants may not be convinced by the result from an automatically conducted assessment alone. When considering the diverse levels and conditions regarding long-term care needs, therefore it was considered desirable to make the final decision through mutual consent among experts from the relevant fields. Applicants can appeal the decision to the respective prefectural certification committee of needed long-term care if they have complained about the municipal government's decision concerning the certification of long-term care needs. Thank you.
Assalamualaikum and hi, my name is Nitliana Nabiha binti Ni Adenai. Okay, now I present about the law involved at nursing home in Japan. Okay, for the first law, it is Act on Social Welfare for Elderly, which is a facility that provides services for taking in elderly in persons and providing them with nursing care services. Second law is Act on Securement of Stable Supply of Elderly Persons Housing, which is supervised by Ministry of Land, Infrastructures, Transport and Tourism, and it requires services residents to satisfy certain conditions that are generally losses than those of nursing home. Okay, for the last one is long-term care insurance law. It is law number 123 of 1997, which is to ensure care of elderly and to facilitate their life according to special needs. So this is generally the law involved at nursing home in Japan.
My name is Lok Ji Hao. I will present impact of the law to the elderly and employee. According to the Ministry of Health, Labour and Welfare of Japan, a population of 2.8 million people for the elderly category who require any of support to deal with thematic based on 2012 data. The total of this make up 9.5% of overall population aged 65 and over, and it is expected to further increase in the near future. Percentage of elderly in Japan reached 26.7% of the population in 2015. In the United Kingdom, it was 80.4%. Hence, Japan is classified as a super aged society. Several policies such as the Long-Term Care Insurance Act is designed to provide to cover elderly who over age of 65. Next, the long-term care insurance system provides service for the elderly such as the in-home service that cover home visit service, for example bathing, nursing care, rehabilitation, commuting service for the care and rehabilitation, short-term stay at care facility and other service. Elderly can enjoy the service provided while being home most of the time. Based on attitude survey on health of the age 2012 Cabinet Office, many older people choose home as their desired place to receive long-term care. More than 40% male elderly and around 30% of female elderly. Other than that, elderly also can choose other service. Facility service and community-based service depend on the needs of elderly as there are 5 care levels. Based on the survey of institution and establishment for long-term care 2011, many users of facility require high-level care in welfare facility, healthcare facility, and sanatorium type medical care facility. Next, I will pass to Lu Gai Wai to present next part.
In 1989, the Goal Plan was implemented and beneficial to the elderly, as the plan is to improve the types of services where elderly can have a better home helpers, short-term stay facilities, and care center. People start receiving their pension even before reaching the age of 65. Premiums are deducted automatically from the pension payout to reduce the procedure. Different category of impaired elderly may have different kind of policy. So the nursing home fee will be waived for seriously impaired elderly and the family income that below certain level. As for the fee for other moderately impaired elderly is set by the national government. Elderly people can receive medical service with a lower co-payment under a special system for elderly. It is called the health service system for the elderly. And next, we will have the impact of law to the employee have resulted in a decrease of turnover rate. And this is because of the demand for nursing personnel is constantly more than the supply due to advanced healthcare and increase in the number of patients. There are few ways that influence the result as the policy such as the scholarship systems for nursing students and budget allocation for nursing education institution is implemented. a better training with a better facilities in a better environment, improve the quality through the act of assurance of workforces of nurses and other medical experts, enacted in 1992.
Hi, Assalamualaikum. My name is Nur Razniza binti Nur Azhar. Next, I will proceed about the certification of the personnel or employee of the nursing home. The purpose of the Japan Association of Certified Care Workers is through the enhancement of the professional ethic and specialized nursing care education and research of certified care workers to enhance their expertise, upgrade their quality, and disseminate the knowledge and skill of nursing care so as to contribute to the increase of the national welfare. A certified care workers is a national qualification in the area of nursing care set under the certified social workers and certified care workers. The term certified care worker was defined in the means a person with expert skills and knowledge who use the appellation certified care workers to engage in the business of providing care for a person with physical disability or mental disorder and intellectual disability that make it difficult to lead a normal life and providing instruction on caregiving to the person and the person caregiver. The roles required of a certified care workers, however, has changed significantly in the quarters of a century since the establishment of the qualification system. It has changed from the provision of personal care only to the provision of support to the daily living of the care recipients, including elderly people, disabled people, and others, through the involvement in their lifestyles and the overall life needs and implementation of the measure towards their sufficiency along with their family members. When the Act was serviced in 2007, the responsibility for quality improvement was added with the following sentence: certified social workers and certified care workers must endeavour steadily improve their knowledge and skill concerning consultation and assistance of nursing in order to adequate the flexible adapt to any changes in service caused by changes in the environment surrounding social welfare and nursing. Thus, the role of the Japan Association of Certified Care Workers as the professional organization working to improve the quality of certified care workers is becoming increasingly important. That's all from me for the certification of the personnel.
Hi, Assalamualaikum. My name is Nora Hamiza binti Mabia. So I will proceed for the question D, which is the development of the personnel certification of Japan nursing home. Okay, the increase of the age population in Japan, better social care are demanded. Informal education for care workers began. There are well of certification of personnel that can help to define the level of correspondence of each employee to requirements specified for his job position. The Social Welfare Workers and the Certified Care Workers Act was formed in 1987. It is to respond to social need of informal education. In the next year, CCW started with 25 education institutions, including the private education institution. Okay, the employee also must have a requirement and qualification for them to work at the nursing home. For example, the number one is nursing care related qualification. This requirement is developing and perfecting your attention to detail, not only ensure you will avoid the medical mistake, but it also help you to give a great patient care. It also try to consider you work from different perspective. Think of your to-do list as people-oriented rather than task-oriented. Next, the employee also must have the Japanese language ability at least from the level 2. According to the JLPT test scale, the JLPT is stand for the Japanese Language Proficiency Test. Okay. JLPT is the standard criterion reference test to evaluate and certify Japanese language proficiency for non-native speakers, covering language knowledge, reading ability, and listening ability. For example, there are 5 types of JLPT level language that must have nursing home employee learn and know. For the level 1 is the ability to understand Japanese used in a variety of circumstances. This level is one to able to read writing with logical complexity and or abstract writing. The next level is the ability to understand Japanese used in everyday situation and in a variety of circumstances to certain degree. One is able to read material written clearly on a variety. Okay, the third level, which is the ability to understand Japanese used in everyday situation to a certain degree. This level is able to read and understand written material with a specific content concerning everyday topics. And the ability to understand the basic Japanese, which is in a level 4, which is to read and understand passage on a familiar daily topic written in a basic vocabulary and kanji. And the last level, which is the basic level, the ability to understand some basic Japanese, which is to read and understand typical expression and sentences written in hiragana, katakana, and basic kanji. That's all from me. Thank you.
Benefit of the law and certifications of nursing home institution in Japan. In Japan, certification care workers is a national qualification established by Japanese government in anticipation of the coming age society. It provides proof that one is an advanced professional who is qualified to provide general living support for elderly people and people with disability. Besides physical care covering meal and bathing, certification care workers must be competent in other fields, such as medical, dementia, hospital care, as well as a service management, physiological and mental to provide a comprehensive approach. The law and certification of nursing home institutions in Japan have many benefits such as obtain a worker's visa, guarantee stable income, and guarantee future in homeland. First, the benefit of the law certification of nursing home institution in Japan is a revision of the immediate law of Japan from 2017, granting a work visa for any foreign who pass the national exam of care worker certification. Based on this law and certification, family members are allowed to accompany. Next, guaranteed stable income is one of the benefits of the law and certification of nursing home institution in Japan. Care professionals shortage have already become a serious problem in Japan, and the need of care workers is only going to grow in the future. Japan is in desperate need of thousands of care professionals. As a result, certification care workers can always find a job and the benefits they enjoy are sure to increase, so that they will have a stable income and list of jobs happen. Last, the benefit of the law and certifications of the nursing home institution in Japan is it guarantees future in homeland. As the world against population continues to grow, international care professionals equipped with learning and work experience in Japan will be a welcome asset in any country around the globe, including their own country. If a foreign nation acquires this certificate, they can work in Japan long-term or permanent as well.
My name is Faziana binti Muhammad Kifli. For the conclusion is a certificate care worker is a national quality in the area of nursing care set under the Certificate Social Worker and Certificate Care Worker Act. The term certificate care worker was defined in the Act mean a person with expert skill and knowledge who use the application certification care worker to engage in the business of providing care for a person with special disabilities or mental disorder and intellectual disability. The long-term care insurance system provides a service for the elderly such as in-home service that cover home visit service, community service, short-term stay at care facility and other disability. That's all.
Law of the Japan for nursing home is a concept of a fee base. It's mean a facility that provides services for taking in elderly persons and providing them with nursing care services are paid. The long-term care insurance system LTCI provides services for the elderly such as in-home services that covered home visit services includes bathing, nursing care, rehabilitations, and commuting services, which is for care and rehabilitation, short-term stay at care facility, and other services. When the Act was revised in 2007, the responsibility for quality improvement was added with the following sentence: a certified social worker and a certified care worker must endeavour to steadily improve their knowledge and skills concerning consultation and assistance or nursing in order to adequately and flexibly adapt to any changes in services caused by changes in the environment surrounding social welfare and nursing. Thus, the role of the Japan Association of Certified Care Workers as a professional organization working to improve the quality of certified care workers is really important.